This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Well, you know, few things can sideline your active lifestyle like a foot injury, whether it's muscle or tendon tears, a sprained ankle, or plantar fasciitis. Sometimes those foot issues are corrected with surgery, and that can take you off your feet for weeks, if not months. Well, another option is regenerative medicine. Dr. Kevin Thomas of Thomas Podiatry joins us to tell us more about this alternative to going under the knife. Thanks for being here this afternoon.
Thank you.
So, okay, let's just start off with what is regenerative medicine?
So to put it simply, regenerative medicine is utilizing healthy living cells or tissue to replace or repair non-viable, healthy, or unhealthy and damaged tissue.
So, one of them that you do in the office, and we've covered before, is called platelet-rich plasma therapy, or PRP.
Correct.
How does that work?
So the way it works is platelets are your body's natural healing cells. They're rich in growth factors. What happens is in your blood there's a mix of platelets and plasma. So we utilize a technique right in the office where we extract some blood from your arm, and then we separate the platelets from the rest of the blood. And then we inject those platelets, typically under ultrasound guidance, back into the damaged tissue.
Wow. So who would be a good candidate for that?
First of all, it's not a replacement for traditional modalities. It's an adjunct. So we still utilize therapy, offloading, strapping, braces, etc. And in certain instances, surgery still is warranted. The ideal candidate is either A, you have the athlete that wants to return activity very, very quickly. This can help them get back on their feet, reduce pain, reduce swelling, help them heal their injuries quicker. Also, the next ideal patient would be someone that's been dealing with a chronic issue for maybe months, even years, and it's just not getting better. A lot of times we can initiate and kickstart the healing process through PRP.
Are there any risks involved with it?
Since it's really just extracting blood, just like when you go to the doctors, no, not really. Obviously, there can be some discomfort after the injection. We do inject it back into the damaged tissue, so for a day or two after, it can be quite sore and a little uncomfortable.
Yeah. So how do you have to get it done several times, or is it once and done?
A lot depends on the extent of the injury. For most minor sprains, typically one treatment usually is adequate, along with the adjunctive physical therapy or proper rest, etc.
Okay. So another regenerative medicine you practice is amniotic cell therapy.
Correct. So the principle is very similar to PRP. We are using healthy, viable tissue to replace damaged. And what amniotic cell is tissue that is derived from donated stem cells, which would be either from placenta or umbilical cords.
Oh, okay. All right. So then what you do, you put it back, you put it into the injury?
Correct. It works the same way. The material is often reconstituted in the office and then injected back into the damaged tissue via ultrasound guidance.
Okay. And I got to ask you again, are there any risks involved with this?
Same thing. There are very, very low risk. Sometimes it's a matter of picking which therapy is appropriate. So for instance, if you are a very healthy, active individual and you have no medical conditions, your own cells are probably very, very healthy. If you are of advanced age or have chronic medical conditions and maybe are not the healthiest person, then maybe would consider using the amniotic cell.
Okay. So these therapies, are they covered by insurance?
They are typically not covered by insurance. We work very closely with the patients to get the best pricing possible. They can be pricey, but if it can avoid a long-term surgery or downtime, it can keep you active, it may be well worth it.
Yeah. All right, Dr. Kevin Thomas with Thomas Podiatry. Thank you very much. Very interesting information.